Hello everyone and welcome to my YouTube channel. And looking at the picture, I think you all must have guessed the topic. Today's video will be seen on cysts and its classification. So let's see what is a cyst. Now cyst is, or it can be defined as a soft, fluctuant swelling containing fluid in a sac which is lined by epithelium or endothelium. Now please make sure to remember this. It is a swelling and this contains fluid, and this is compulsory that it is lined by epithelium or endothelium. Now, if you see the nomenclature or if you see the derivation of this word, it comes from a Greek word and which means bladder. Okay, so remember that it is a soft, fluctuant swelling containing fluid and lined by epithelium or endothelium. Now let's look at the classification. Now there are two types of classification. One is true cyst and false cyst. The other is based on when it was developed. So it can be classified into congenital cyst or acquired cysts. So let's see the first type of classification, that is true and false. Now what is a true cyst? So true cyst is a cyst which is lined by epithelium or endothelium. Now, if there's any injury or if it gets infected, the lining may get changed or make it converted to granulation tissue. Okay, so the lining can also have be granulation tissue. Now, if you see the content, now as we saw in the definition, it contains fluid. Now, this fluid can be serous or mucoid, and the color can depend on colorless or maybe brown if there's presence of blood. And some cysts also have cholesterol crystals present in them. That is one type of content where it can be fluid, serous, or mucoid. The second type is the porridge or the toothpaste. Now, here what happens, it becomes thick or the consistency, or it becomes more of viscous because there's accumulation of desquamated epithelium within the secretion. And examples of this are dermoid, epidermoid, branchial, and sebaceous cyst. Now, we'll see these cysts in the coming slide and in detail in another video. So for now, just remember that the content can be fluid or porridge type. Porridge because of accumulation of desquamated epithelium. You see that the lining here is there, it is lined by epithelium. So when this gets detached, or when these get desquamated, the content can become porridge or toothpaste like. Okay, so moving on to the next type, that is a false cyst. Now it is also called as a pseudocyst. Now this again has two varieties. So one is the exudation cyst and another is a degeneration cyst. So what do you mean by exudation cyst? So if you must have heard this particular term exudation in term, or in relation to inflammation. So here what happens, during inflammation, they can be the exudate or the fluid. They can accumulate in anatomical spaces. Okay, so one of the example of this is the pseudopancreatic cyst, and this is usually seen in case of pancreatitis. So what happens? There is inflammation. The enzymes can leak out, and these enzymes start digesting their own tissue, which again further increases the or worsens the inflammation, and because of this there is a fluid accumulation, and this is usually getting accumulated in the lesser sac. So that is one example. Another example, what you can see is in case of tuberculosis of the intestine. So what happens is here also there is a exudation of fluid, and this gets collected between the coils of the intestine here. And next is the vaginal hydrocele. So what happens is, if you can see in the image, so this is the testis, and this is lined by the tunica vaginalis. Now this tunica vaginalis normally has a fluid which helps in the lubrication, so that it helps in the movement of the testis in the scrotum. So if there's any problem with the either the production or absorption or obstruction in in for this particular fluid, it can lead to hydrocele. So we have seen three examples of exudation cyst, that is pseudopancreatic cyst. Then you have cyst in case of tuberculous peritonitis, where the fluid is present within the coils of intestine or lined by the coils of intestine. And then you have the vaginal hydrocele, which is seen in this picture. You can also see here the pseudopancreatic cyst usually gets accumulated in the lesser sac. Now, coming to the next type, that is the degeneration cyst. So this is usually seen in the tumors. Okay, so what happens? That the central portion or the central part of the tumor may have a lack of blood supply, because of which the cells and the tissues start degenerating, and after the degeneration, it can become liquid like. Okay, so This is usually seen in the tumors. So yeah, and they develop ischemic necrosis or colligative necrosis. So because of the necrosis and the damage or the dead tissue present, this can appear like a cyst. Okay, so under the false cyst, we have seen two types: exudation cyst and the degeneration cyst. Coming to the second type of classification, yeah, so this is the picture. So this can be a tumor, and in the central portion you can see there's a degeneration of the tissue, because of which it becomes a liquidy or fluid in nature, and this gets encapsulated, or this is present between the tumor cells. So this is an example of degeneration cyst. Coming to the second type of classification, you have the acquired and the congenital. So let's see the congenital variety, or examples of the congenital variety. So here you have sequestration dermoid, tubuloembryonic or tubulodermoid cyst, and cysts of embryonic remnants. So let's see the first one. What is a sequestration dermoid? Now, what happens is here, as you know, in the embryology part, the different parts are formed by different processes. Okay, it's like a puzzle. A complete puzzle is formed by different pieces. So here also, if you take the example of a face, okay, so a face is formed by five processes. Okay, so this can be the frontonasal process, this is your maxillary, and this is the mandibular processes. So when these all together join or fuse, they form the face. Now coming back to what is sequestration dermoid. Now sequestration dermoid is, when these dermal cells, okay, when these dermal cells they get buried at the point of the fusion of the embryonic clefts or the processes. Okay, so this leads to the formation of the sequestration dermoid. So if you can see in this picture, so I told you that these processes join and they form the face. Now coming to a very simple example, now just imagine these two are the processes, and as they form, sometimes the dermal cells can get stuck here, or they can get buried here within the fusion line. Now this accumulation of these cells can result in the formation of a cyst. So this is how a sequestration dermoid is formed. Okay, so usually if you see the site where these cysts can be formed is in the midline. Okay, it is very commonly seen in the midline, especially in the neck, or it can be seen in the outer angle of the orbit. So this is the place where one of these processes, they just fuse, and sometimes the cells can get deposited or buried in them, and in the upper part of the anterior triangle of the neck. Okay, so same thing, if you see the picture here, this is your branchial processes, and this helps to this gives rise to the ears, the structures in the throat and the neck, and yeah, your jaws. So what happens when these two fuse from this left from the sides to the middle, sometimes the cells can get buried and they can form a cyst. So you can see the pictures here. This is an example of a branchial cyst, and this is the example of the angular dermoid which we saw. Okay, so usually seen in the fusion lines. Okay, so the sites are, again, we'll just see, it can be seen in the midline of the body, outer angle of the orbit, and the upper part of the anterior triangle of the neck. So the pictures are there here. So these two are examples of the sequestration dermoid. Moving to the next type, you have the tubuloembryonic or tubulodermoid cyst. So what happens? These cysts, they develop in the tract of an ectodermal tube. Now let us understand what is an ectodermal tube. Okay, okay. Taking the example of thyroglossal cyst. Now, you know that the thyroid gland actually forms at the posterior end of the tongue. Okay, in the buccal, in the oral cavity, it is formed in the posterior end of the tongue. Now we know that the throat is actually present in the throat or in the neck, in the anterior neck. So if the thyroid gland has to come to its original position in the throat or neck, it has to travel down from the tongue to the throat, and for that there is a passage or a tube. Okay, and this is called the thyroglossal tube. So now what happens is, sometimes after the thyroid gland has shifted from the tongue and it comes down in the neck, okay, this particular tube, in this tube, some of the cells can start proliferating and they can lead to a formation of a cyst. So that is the example of thyroglossal cyst. Similarly, you have ependymal cyst. Now this structure is related to the ventricles in the brain. Okay, so this is derived from the ventricular structures. And then you have the pituitary cyst that is formed because of the non-obliteration of the rat case pouch. So after the formation of the pituitary gland, this rat case pouch sometimes can remain, and this can lead to a pituitary cyst. Okay, so this is an example of a thyroglossal cyst. Okay, this which can be seen in the ectodermal tube. Similarly, here after the formation of the pituitary gland, there can be a remnant of the rat case pouch, which is present in the form of a cleft, and here a cyst can be produced. Okay, so remember that this is formed in the tract of an ectodermal tube. Okay, so usually once the work of these ectodermal tube is done, they usually obliterate, but sometimes they remain and they can form the cyst. So examples again, just revising: thyroglossal cyst, ependymal cyst, and pituitary cyst. The next is cyst of embryonic remnants. So what happens is there are certain structures in our body. Again, like in the previous type, they have a certain function, and then they, after the function, they obliterate and they form a fibrous remnant of it. Okay, so here the examples are cysts of the urachus and the vitellointestinal duct. Now, if you see the urachal cyst here, this is the picture. Now we saw that this particular urachus is actually it's the fibrous, or the the remnant of allantois. Now allantois helps drain the urinary bladder of an infant or of an embryo, you can say, or an infant in the uterus. It helps to drain the urinary bladder out through the umbilicus, and this goes to the mother's circulation. So once the work is done, this particular structure, allantois, it forms fibrous tissue, fibrous remnant, which is called as urachus. So sometimes this particular structure can give rise to a cyst, which is called as a urachal cyst. Okay, and this can appear like this on the surface. So somewhere in the umbilicus, it can appear. Another type that we saw is the vitellointestinal duct. Now, this vitellointestinal duct is actually used for the nutrition of the growing embryo. And like the allantois, this allantois actually drains the urinary bladder. Vitellointestinal duct helps in the nutrition of the embryo. Okay, so this can also lead to the cyst formation. There are other problems related to the vitellointestinal duct, but we are not discussing it too much here. It can lead to sinus. It also gives rise to Meckel's diverticulum and the fistula. But here, what we are concerned is with the cyst here. Okay, so this can also lead to a cyst. The next variety is hydatid of Morgagni. Now, Morgagni is formed from the remnants of the paramesonephric duct. Okay, now paramesonephric duct is also called as a Mullerian duct, and this helps in the derivation of the female genitals or the female organs. And the next variety is the organs of Gerard's, and this is the remains of mesonephric duct, which is also called as a Wolffian body, and this helps in the derivation of the male organs. Okay, so the pictures are here. So here you can see here the cyst of Morgagni, and then you have here you have the cyst of Gerard's. Okay, so this is your cyst of embryonic remnants. So we saw that there are three varieties in the congenital type. One is a sequestration dermoid, where it is because of the burial of the dermal cells in the embryonic fusion lines. Okay, and then you have the tubular embryonic or tubular dermoid cyst, which here the cysts are developed in the tract of an ectodermal tube, and examples are thyroglossal cyst, ependymal cyst, and pituitary cyst. And then the last one is a cyst of embryonic remnants. So these are the fibrous remnants of previous structure which was there in the embryo, and the cyst arise from these structures. Okay. The next variety is the acquired cyst. Now, acquired cyst has a lot of types. Now, the first variety is a retention cyst. Now, what happens here? It is usually associated with the glands. Okay, so the glands have a function of secreting something. So, if there is an obstruction or to the outlet of the secretion, this can lead to the development of the cyst. Okay, so the most common type of retention cyst is the sebaceous cyst. Other types are mucus cyst of the lips and cheeks, and the parotid cyst. So yeah, this can be the picture of the mucus cyst. This can be a sebaceous cyst, and then this is a cyst in the cheek or in the oral cavity. Okay, so what happens? The glands they secrete, but the outlet is kind of obstructed or blocked, and because of which it can lead to the distension of the gland and appears as a cyst. Okay, and the next variety here is your distension cyst. Now, distension cyst, what happens here? Again, it can be associated with the glands, but here there's no problem in the duct, or there's no obliteration, or there's no blockage of the duct. Here there is the acini or the follicles of the gland. They become bigger in size. So if they become bigger in size, their production may increase, because of which that it may give a cystic appearance. And the other varieties are the exudation cyst, which you already discussed in the previous type of fall cyst, and the degeneration cyst. So this we'll not see again. We'll move the next type. Then you have the cystic tumors. So cystic tumors, that is the cyst arising from the ovary and of the breast, are examples. The other type is the implantation dermoid. So what happens here? This is usually seen because, or usually seen after an injury. So what happens during an injury is, especially the penetrating injury. So here, some of the dermal cells may be pushed inside, because of which it can lead to, or it can give rise to, a cyst. And the sites are very peculiar here. It is usually seen in the finger, the hand, or the sole of the foot, because these are the places where you usually see injuries happening. And mostly, if you see the profession, it can be seen in tailors or farmers, or those who are doing a lot of gardening work. So implantation dermoids are seen in certain areas. Next, you have another variety, that is a traumatic cyst. Now, traumatic cyst can be because of the collection of the blood, okay, and as it resolves or as it heals, this sometimes can end up in a cyst. Now, if you see the content, it is usually a straw or brown colored fluid, again because of the presence of blood, and sometimes you can also find cholesterol crystals here. And here it is lined by a endothelium. Okay, so this is another variety where you have the traumatic cyst. Next, you have the parasitic cysts. So here, depending on the organism, the different cysts are seen here. So the hydroid cyst, it is seen usually in the Taenia echinococcus. Now, Taenia echinococcus it's a parasitic infection, usually from the dogs, and this can cause cysts in the lungs and the liver. So you can see here, there's a cyst here. Okay, so this can be caused because of the parasites. Next variety here is of the cysticercosis. So this is caused by Taenia solium, and this is usually the because of the infection of the through the pigs. This can be got. And next is the trichiniasis, because of the Trichinia spiralis. Now, this usually affects the muscles. So cysts can be seen in the muscles. So this is another variety of acquired cysts, that is the parasitic cysts. Now, usually on X-ray, these cysts can be visualized. Okay, so this is the classification of cyst: true cyst, false cyst, and then you have the congenital and the acquired cyst. Next, moving on to the clinical features. So, when you take the history of a patient complaining with a cyst, you need to ask whether, from when is the cyst? Like, is it from birth, or is it, recently, it is have developed? Then also you should also ask about the onset. Okay, whether it occurred by itself or spontaneously, or whether he got a disease and then he developed the cyst, or following an injury. So as you know, parasites can also cause a cyst. So there may be some symptoms before the development or the presence of the cyst, or whether the injury, like you have seen the traumatic and the implantation dermoid. Next, you should also always ask for the pain, whether it is painful or painless. Now, if it is painful, then you should suspect there's some kind of inflammation, going on because of infection. So always ask about the pain, and ask about the growth, whether it is fast growing or slow growing. And also ask about other symptoms related to the general health, whether there is anemia, check for anorexia, cachexia. Okay, so this can help us to see if there is a cystic or any degenerative cyst here. Okay, so this is about the history that you need to ask. Moving on to the inspection, you should always ask where the site is. As we saw, there are some cysts that are having a specific area. For example, the dermoid cysts grow in the midline, and then you have the implantation dermoid that grows, that is not growing, that is seen develop in the palm and soles. So site becomes very important. Also the number, okay, whether it is one or two, three, or multiple. So usually multiple cysts are seen as a feature of sebaceous cysts. Then you should also see the surface and the margin. Usually the surface is usually smooth and it has a regular margin. So this can be seen on inspection. Next, coming to the palpation. Now, if you palpate, the surface usually if you, feels very smooth and this is spherical and it's a regular in the feel and the margin and the consistency. So a cyst, if you see, is usually soft, and if you sometimes press, there can be a certain and there the cyst might yield. Okay, so but sometimes the cyst can also be hard. Okay, they usually seen in sebaceous cyst, it is usually hard, but usually the consistency of the cyst is soft. And fluctuation, if you see the cyst fluctuates, or if you just hold it and it kind of shakes, or it not shakes, it moves. Okay, fluid thrill is present, and especially if it is a large one. And if you see translucency, the if you project light to the cyst, it kind of absorbs, and the light can be seen like this. Okay, but there are certain cysts which can which in which a translucence test or transillumination test is negative, especially in the dermoid cyst, sebaceous cyst, and tumors. As we saw, the content can be toothpaste or porridge-like material, and this material does not absorb light. Okay, so in such cysts, the transillumination test may be negative. Okay. Now, what do you think a cyst can do? So the presence of a cyst, if it's not very big, then it doesn't matter. Also, the surrounding structures where it is placed can also make a matter. So if the cyst is big and if surrounding it there are a lot of structures, it can cause some compression. So especially the blood vessels. So if you see the example of ovarian cyst, if it is too big, it usually leads to varicose veins because of the pressure. Okay, so it usually has pressure symptoms, or the effects are usually because of the pressure. Next, if you see the complications, one of the most common complication is infections. So usually cysts are painless, but then if it gets infected, they start developing pain, and slowly this can form into an abscess, which can break, and this can form an ulcer or a discharging sinus. Next is a hemorrhage. So hemorrhage within the cyst is also a very common complication. So this also presents as a pain. So suddenly the patient might say, till yesterday there was no pain, but today I'm having severe pain. So always suspect hemorrhage in that condition when there's a sudden change or sudden pain in the when the patient complains of sudden pain, and this is usually seen in the thyroid cyst. Okay, this complication of hemorrhage. Next is a torsion. Now, you know what is torsion? Basically, it's twisting. Okay, so because of that, there can be certain problems. And this is usually seen in the ovarian cysts. Okay, the next complication that you can anticipate or you can see here is the calcification of the walls. Okay, now this doesn't happen in a short time. This is seen in long-standing cysts. Okay, and the most common example that you can think of here is the hydatid cyst and the cysticercosis. So mostly the parasitic cysts or cysts because of the parasites. So just to quickly summarize, cyst is a fluctuant, a soft fluctuant swelling, and this contains fluid and lined by epithelium or endothelium, and it can be classified as true cyst and false cyst. True cyst is the one that has endothelium or epithelium, and the false cyst does not have this kind of lining. And false cyst further is of exudation variety and degeneration cyst. And if you see the second type of classification, you have the congenital cyst and the acquired cyst. Now, congenital cyst can be of three types: sequestration dermoid, tubular dermoid, and cyst of embryonic remnants. And the acquired cyst, you have retention cyst, distension cyst, exudation cyst, degeneration cyst, cystic tumors, implantation dermoid, traumatic cyst, and the parasitic cyst. So this is a small classification and a brief description on cyst. So thank you for watching my video on cyst. See you in the next video. Thank you.